A study by the Urban Institute put forward data saying that 82% that would be newly eligible for Medicaid under Obamacare would not have a child in the household. Not only that, but of that 82%, 69% would be men and women aged 19 to 44, what many would concede as the best working years of a person's life. Under Obamacare, through enhanced match rates, Medicaid expansion states have seen federal Medicaid dollars increased for working-aged, able-bodied adults anywhere from 133% to 200% more than the funding for those who qualified for Medicaid prior to Obamacare, including seniors and individuals with disabilities. The discrepancy in the amount of funding between Medicaid expansion and traditional Medicaid is a gross injustice to the people that Medicaid was originally designed to protect: the elderly, the blind, and the disabled. Madam Chairman, in my home state of Arkansas, the Kaiser Family Foundation reports that there are 2,955 disabled people on a waiting list for Medicaid, for a Medicaid home community-based services waiver. And the story is the same across the country. In my neighboring state of Texas, 116,000. Florida, 21,000, Illinois, 16,000, and on. Nationwide, hundreds of thousands of people with disabilities and the elderly are being penalized and punished through no fault of their own because on March 21st, 2010, this House, led by many of those across the dais today, made a conscious decision to increase enrollment for young, able-bodied adults into a program that was intended to help the truly needy, the elderly, and the disabled. The gentlelady talked about my home state of Arkansas. My state took the Medicaid expansion. One of the many families affected by the neglect of the traditional Medicaid program in my state is the family of Ms. Skylar Overman. Skylar was born with a rare medical neurological condition. In a 2016 news report, Lindsay Overman, Skylar's mother, said that she feared her daughter won't live long enough to receive the assistance she has been waiting on nearly her entire life. Skylar's condition causes her to have multiple seizures a day, and her faithful mother is her full-time caretaker. The Overman family and many families like them can't just call up a babysitter if they need to step away for a couple of hours, but a Medicaid waiver would help pay for that. Under Obamacare, we have seen Medicaid rolls increase by millions of people, spending increase by billions of dollars, but unfortunately, it has caused the needs of disabled people such as Skylar Overman to be put on the back burner, all in the name of insurance coverage, not health care. Madam Chairman, I find it appalling that the needs of the truly needy in this nation are being ignored to protect a political legacy. I believe it is well past time that we as leaders stand together and say no more. It is time that we return the Medicaid program back to the purpose for which it was created, and that is to help the elderly and disabled. I ask my colleagues in joining me in untying the hands of our nation's governors so that they have the ability to take the federally provided money through Medicaid dollars and assist their citizens the best way they know how. I urge my colleagues on both sides of the aisle to stand for those who truly need our help and oppose this amendment. I would like to now recognize Mr. Rokita for 3¼ minutes.
I thank the gentleman for yielding. You know, as the federal government has imposed more and more red tape and regulations, and states have cut payments to healthcare providers, low-income patients, many of whom live in medically underserved areas, have less and less access to quality care. Medicaid recipients frequently have a hard time finding a doctor and often encounter long wait times to see the few doctors that will even accept Medicaid in its current form. Something has to be done. Medicaid recipients also frequently receive inferior medical treatment, are assigned to less skilled surgeons, receive poor post-operative instructions, and suffer the worst outcomes than people on private insurance. A 2007 study by Jay Shen and Elmer Washington found that Medicaid enrollees had longer hospital stays and were charged more for hospital visits than either uninsured patients or those in private insurance. Uninsured patients have shorter hospital stays than those who are forced to take this broken Medicaid system and promise. The American Health Care Act puts Medicaid on a budget. It doesn't cut Medicaid. Funding will continue, and it will continue to grow to match the needs of the states to cover their populations that are most in need. But it no longer, under this plan, would reward states who don't treat their providers well or otherwise want to game the system. With almost $20 trillion in debt, this is the responsible thing to do, to care for our most vulnerable, to provide the proper safety net without a hammock, and also begin making sure that the next generation isn't the first generation in American history that will be worse off than the current one. It's never been done before. Members on this committee shouldn't allow this to happen. This is the right way forward. Please deny this motion to instruct. I yield to the gentleman.
Thank the gentleman from Indiana, and I yield to Mr. Renacci for 3 1/4 minutes.
Thank you, Mr. Westerman. As members of the House Budget Committee, I think most of us would agree that our priority is to establish and enforce control over our budget. Today, as members of this committee, we are given an opportunity to do just that in the realm of health care. Though I am not debating the life-saving health care services that Medicaid provides to a vulnerable population, we can't ignore the direction the Medicaid program is taking. My friends on the other side of the aisle claim that by phasing out Medicaid expansion, we are stripping away coverage from the most vulnerable. I also heard the word betrayal. I believe the contrary is true. By continuing on this path of unsustainability, we are betraying the American people and are slowly stripping away any possibility of prospects for our children and grandchildren. We are on an unsustainable path. We can't keep spending money we do not have. If we sit and do nothing at its current rate, Medicaid spending will reach $957 billion by 2025. Again, unsustainable. That's the betrayal. This reconciliation recommendation that we're reviewing today takes the first step in modernizing our outdated 1965 design of Medicaid that has made it impossible for states to manage their budgets. By transitioning funding into per capita allotments, we are strengthening our Medicaid program for the future. Through the American Health Care Act, states will have greater flexibility to introduce innovative ways to reduce costs by tailoring programs specific to their individual populations. In addition, the AHCA empowers states through a patient and state stability fund with $100 billion to further assist states to cover low-income populations. By making these common sense reforms, we will finally be able to bend the cost curve that has crippled our budget for too long. Look, if you haven't already got it, my point is we are on an unsustainable path. We are the Budget Committee. In less than 10 years, we will be looking at a $1 trillion spending and counting in federal Medicaid dollars. This unsustainable path jeopardizes the ability of the federal and state governments to provide that assistance to our most vulnerable patients who rely on this program. The AHCA empowers us to be better stewards of our taxpayer dollars. It is the same thing American families have to do every day. Spend within their means. It's the same thing small businesses have to do every day. Spend within their means. Do we need to take care of our most vulnerable? Yes, we do. Today, tomorrow, and in the future by spending within our means. But the answer is being a better steward of taxpayer dollars and just not close our eyes to the fact that the current program is unsustainable. And I yield back.
I thank the gentleman, Madam Chairman, to provide the best care to the most vulnerable. We not only need to deny this motion, we need to fully repeal the Affordable Care Act through this bill and future actions, and we need to enhance this bill to give states the flexibility to provide for their own. With that, I yield back.
The gentleman yields back. Ms. Jayapal, the proponent of the motion, is recognized.